We are here today speaking with Eva Matuszewski, the CEO of MedNetOne in Rochester, Michigan, for the second in a series of podcasts on the patient-centered medical home. Ms. Matuszewski is one of the state's leading experts on the patient-centered medical home, a timely and fast-growing development aimed at improving primary care and patient health. Let's get started. Eva, does the patient-centered medical home have any guiding principles?
The patient-centered medical home is described in joint principles that have been signed by several of the nation's leading medical groups, including the American Academy of Family Physicians, American Academy of Pediatrics, American College of Physicians, the American Osteopathic Association, and most recently, as of November of 2008, the American Medical Association.
Can you describe the key points of the joint principles of the patient-centered medical home?
I'd like to start with the primary care physician's role. This is an important one because the primary care physician, PCP, is at the core of the PCMH with the patient, partnering with the patient as a whole person to ensure comprehensive and compassionate care for optimal long-term health. The PCP partners with the patient through care at all life stages: preventive services, acute care, chronic care, and end-of-life care. Included in that relationship is a memo of understanding. The primary care physician and patient may sign or may agree to a written document known as a memo of understanding to define their respective roles. It's the first visible step in establishing the patient-primary care physician relationship in the medical home. Then we look at patient engagement and care. With the PCMH, individuals can expect improved care, but it is contingent upon their ability to become educated about health maintenance and wellness practices and to modify or eliminate certain behaviors to better self-manage their health. This could include participation in smoking cessation programs, weight loss programs, or even self-management strategies.
Does that mean that the patient is on their own when it comes to certain healthcare practices?
Oh, not at all. The patient and physician work in partnership to address preventative care, treatment plans, follow-ups. Plus, with the PCMH, the patient has easier access to his or her medical records. And let's touch on care coordination. When the need for comprehensive care requires the primary care physician to introduce the patient to a specialist outside the medical home, the PCP remains the primary medical contact for the patient, coordinating care among the specialty physician or physicians and other members of the healthcare community.
In other words, Eva, the patient doesn't have to wing it when it comes to specialty care.
Oh, that's absolutely right. The patient-physician partnership continues even when the PCP is not providing the care. And let's also touch on integrated and comprehensive approach to care. When specialized care is required, the primary care physician and his or her team coordinate care for patients between all elements of the healthcare system, from hospitals and rehabilitation facilities to home health care agencies and even community-based programs. Plus, care is facilitated by population registries, information technology, and health information exchange to ensure patients get the recommended care when and where they need it. And it's also important to address routine feedback to physicians. This is a subject that is new to healthcare, perhaps has been in use by managed care organizations in the past. But with the patient-centered medical home, the patients are actively involved in the decision-making process and even provide feedback on physician performance.
Can the patient even provide negative feedback?
Oh, absolutely. Yes, physicians who advocate the medical home concept want to hear all feedback, the feedback to improve their patient care approach and maintain positive relationships with their patients and even with the patients' families. And let's also touch on access to care. With the patient-centered medical home, the primary care office team personnel know the patient's personal health history and can quickly triage patients to the appropriate provider, either the PCP or an allied health professional that works with the physician. The patient-centered medical home also uses electronic and telephonic medical consultations, sometimes making office visits unnecessary. Additionally, many offices now are extending hours of coverage. It's no longer regular business hours are from 8:30 a.m. to 4:30 p.m. It's also important to know that in this superb access to care, patients might be able to access their physicians directly via cell phones, and we're seeing that type of access occurring with greater frequency at the primary care level. And if we're talking about access to care, what about access to clinical information systems? The patient-centered medical home is a very tech-savvy organization. With the patient-centered medical home model, evidence-based medicine and clinical decision support tools guide physician-patient decision-making. As a matter of fact, health information technology is one of the benchmarks used by the patient-centered medical home to gauge quality improvement. And in Michigan, we all have access to a phenomenal series of evidence-based guideline tools through the Michigan Quality Improvement Consortium, and hopefully not only our physicians, but also the patients will be able to take a look at those guidelines and become more actively engaged in their care using those guidelines as a form of consultation.
Eva, is the physician compensated for his or her time spent using all this technology?
Yes, the physician reimbursement model under the PCMH model includes time spent in remote monitoring of clinical data using various tech tools, but this does not hold for every single health plan. In Michigan, for example, many of us are fortunate to be included in the Blue Cross and Blue Shield of Michigan Physician Group Incentive Program. That particular program allows for physician teams, not the physician, but the teams, to bill for telephonic services called booster calls. This tremendously enhances the quality of care and access of care for those patients. They can reach their clinicians and they can continue to be monitored by those clinicians that want to provide the oversight at the right time for the right reasons. And lastly, I'd like to touch on this publicly available information. In the Detroit area, the Greater Detroit Area Health Council, GDAC, has already published information relative to physician statistics and their outcomes. This is a really practical benefit. The PCMH offers the public the opportunity to review databases of standardized information on physicians to help them choose a PCMH practice. Also, the PCMH guarantees patient confidentiality while also delivering transparent data from population registries that can be used to track not only diseases but also prevention trends geographically. It really moves us closer to having a truly national view of our country's most significant health concerns and treatment solutions.
Thanks, Eva, for sharing with us the joint principles of the patient-centered medical home.